risk every year. Thousands of people are diagnosed with pancreatic cancer, but for a staggering number of them, that diagnosis comes too late. Why? Because this disease is a master of disguise. It doesn't typically announce itself with a sudden, dramatic event. Instead, it begins with whispers, subtle, insidious clues that are all too easily dismissed. We treat them as the mundane aches and pains of modern life, a bit of indigestion, stress from work, the inevitable signs of getting older. My mission today is to pull back the curtain on these quiet symptoms. We need to elevate our collective suspicion, to recognize the patterns that demand a closer look. Because when it comes to pancreatic cancer, what you don't know can be the most dangerous thing of all. This isn't about creating fear. It's about building an informed vigilance that could save a life. We must change our perception of what constitutes a serious symptom. When the early signs of pancreatic cancer appear, they often masquerade as common, everyday complaints, leading both patients and clinicians down the wrong path. It's a diagnostic challenge of the highest order, and understanding why these clues are missed is the first critical step in solving the puzzle. Let's begin with one of the most frequently misinterpreted signals: unexplained back pain. Someone might develop a persistent, dull ache in their mid-back, often described as a deep, boring pain that seems to radiate from the inside out. The immediate, logical conclusion is that it's a muscular issue, perhaps from lifting something heavy, poor posture at a desk, or the onset of arthritis. They might see a chiropractor or a physical therapist. They might take anti-inflammatory medications, which may offer temporary, incomplete relief. But the pain lingers. What's being missed is the possibility of visceral referral. The pancreas is located deep within the abdomen, pressed up against the spine. As a tumor grows, it can push on surrounding nerves and tissues, sending pain signals directly to the back. This isn't a muscle problem. It's a sign that an internal organ is in distress. We have to learn to question back pain that has no clear musculoskeletal cause, especially when it's persistent and unresponsive to standard treatments. Next, consider the development of new-onset diabetes, particularly in an individual over the age of 50 who is otherwise healthy and doesn't fit the typical risk profile. Diabetes is incredibly common, so when it's diagnosed, the conversation usually revolves around diet, exercise, and medication like metformin. The underlying cause is assumed to be the standard mechanism of insulin resistance. But we are now learning that for a subset of individuals, the pancreas itself is the root cause. A tumor growing within the pancreas can damage or destroy the insulin-producing beta cells, leading to a sudden and unexpected spike in blood sugar. In some cases, this can be the very first detectable sign of pancreatic cancer, appearing months or even a year or two before any other symptom. Another red flag combination: persistent, vague digestive issues like bloating, combined with unintentional weight loss and a loss of appetite, or a slight yellowing of the eyes, coupled with pale stools and dark urine. These are not isolated incidents. They are interconnected data points, painting a portrait of systemic dysfunction originating from the pancreas. Our job is to connect these dots. We must train ourselves to see the pattern, because it is in the combination of these seemingly unrelated, non-specific symptoms that the true signal of danger emerges from the noise.